Look, don't fret. It's really an investment in yourself that will reap dividends down the track. It really will. But it's more about how you approach it. So, there's a saying by Alan Dare Pierce who said, he talked about exams saying, look, exams aren't fair. Those that study have an unfair advantage. So I think the important thing is, put a little bit of effort into the exams, a little by little, and it will all add up. So, you're going through your professional, personal life. Make sure that those don't suffer whilst you're doing the exam. There's no point, acing the exam and ending up with, I don't know, say a breakup or a financial difficulty or things like that. So, it's important to have a good work-life balance. And it will reap dividends and a good return on investment on your personal and professional life. Now, when I look at individuals over the years, so obviously I've met a lot of trainees through the courses, and broadly, I don't want to be sort of accused of stereotyping individuals. Broadly, we know that there are two types of individuals. There's the detailed kind of person, whilst there's the big picture kind of person. And we all like to be in our comfort zone, there's no doubt about it. But what happens is for the exam, as you can see, the skill set is diverse. They're trying to make you sort of a complete psychiatrist, a complete doctor. Now, the big picture individual often is able to sort of look at the formulation and the management and give you a diagnosis, and they're able to sort of very quickly say, oh, look, this is what it is. These are the key points, because they're able to get a bird's eye view very quickly. But what happens is they might not necessarily be able to get through certain components of the exam easily, because certain components of the exam require attention to detail. So these individuals will need to develop certain skills with regards to the detail aspect. Okay, so you do see sometimes registrars, and you may have a few in the service, but I do know often people say, this registrar is excellent, he's such a good clinician, but he's not gotten through the exams. Just not getting through the exams no matter how many times he sits them. Whilst on the other hand, you've got the really detailed individual that can, and the tendency to procrastinate can be quite high. As a result of that, they sometimes don't end up completing the paper. So, and not completing the paper, it's very, very difficult to pass. And it's because just find it very, very difficult to move on from a question, or in an MEQ, for example, being excessively detailed is a real problem because you won't complete the paper. So it's what you essentially have to do is to look at achieving a balance. So for an essay, big picture works brilliantly because you get a nice breadth, you think big picture, and you don't go too detailed. Very good. But for the MEQ, for example, or the EMQ, where you have to look at the details of psychopathology and know the buzzwords, it might not work, the big picture bit. Okay, so does that make sense? It's sort of a balance that you've got to achieve for the exam, because that's what's expected in clinical practice as well. Okay, so don't lose perspective overall. Try to achieve a balance. Similarly, you've got 4 types of individuals in terms of learning. And what you're trying to do is, through your journey, ask questions, ask 4 different types of questions. So normally, we've got the analytical individuals who would just want to learn concepts. And because a concept's there, it must be true, and that's what an individual will hold on to. Whilst there may be the other group of individuals that says, well, how is this relevant? They may sort of rely a lot on the common sense aspects. The other one is the dynamic one, well, says, I'm not going to do it this way. Maybe that's the way of doing it. I'm going to change the way things are done. And the last one is the imaginative one, the innovator, who may be asking questions, in relation to why. Why does this particular thing happen? Probably the most annoying one for an academic to sit in the room, because some of those questions might not be able to might not have answers. Having said that, it's a very, very useful trait to have. So what you're trying to do is to ask these sorts of questions with the kind of clinical scenarios that you're coming across. Because this sort of constant thinking really, really helps. It becomes second nature after a while. And when you're in the future going to be on your own doing private practice, this helps. Because you have to think of different ways of addressing a single problem. Because, you know, arriving at a diagnosis and prescribing medication is probably the easiest thing in private practice. But what happens in private practice is, so today, for example, I got a call from a GP. I've got a patient with a friend of mine. He's got a diagnosis of bipolar disorder. Last time he saw a psychiatrist 15 years ago. He's a principal of a school, recently been promoted, finding it very, very difficult to manage, extremely stressed out at work. I think he's becoming depressed. He's not suicidal. Okay, I'd like you to see him. You can already see what the issues are going to be. This is not going to be about, he's already on medication. So it's not going to be, okay, I'm going to start X medication and he's going to be fine. No. You can see the issues there. This is not going to be an easy one. It's highly likely he's got perfectionistic traits, which the GP then said, yeah, absolutely. He's very, very driven. He has a family, but not much else. He's got background stresses. Work is a vulnerable situation. So you can see what I'm going to have to liaise with work. Do you think he's going to want me to liaise with work? Do you see where the real issues lie? Once you enter clinical practice and you're looking at a longitudinal view of an individual. And this is what happens in private practice when you're seeing people for 2 years or more. You actually see the evolution of the disorder in different ways. And you're actually dealing with, say for example, the children. So I've got a summons for court, for example, some of them saying DHS. So I've got a summons for court, but have a think about this now. I've got to think about the therapeutic relationship rupture with the patient. Because am I going to give evidence with the patient there that might potentially not be in her favor? So I might have to write a note in advance for the judge saying, you know, this may potentially rupture therapeutic relationship. Did I have the expertise? I haven't completed a parenting capacity assessment. So am I the best person to provide that evidence? What evidence, you know, what suggestions do I make? So you can see that, yes, she's got substance abuse. Yes, she's got likely a mood disorder. But there's a whole other issue out there as well that is impacting on her illness, and you've got to manage the whole lot. Okay, so and that's what the MEQs are about. So the MEQs aren't about how do you treat her substance abuse and mood disorder. It's going to be how are you going to approach this request from court. That's what the MEQ is going to be about. So there are clear steps and principles that you follow when this happens. Because the question is, are you a treating doctor or are you being called as an expert witness? Two different roles completely. Right? Because as an expert witness, you obviously have to provide evidence to the court, okay, independently. The confidentiality agreements with the patient are completely different. So all of those things are completely, everything changes, okay? So what will help is actually thinking about what happens if this particular patient down the track has children, for example, and this person's severely unwell. Another example, I've got a patient with who's 35, had a very severe manic episode. She's stabilized, doing well. She's got to go back to work quickly, wants to increase her hours quite quickly because of financial stresses related to a mortgage. But at the same time, because she's 35, wants to actually plan for pregnancy next year. Do you see the difficulty? It's not treatment of bipolar disorder. That was the easiest bit. So how do I manage increasing her hours and providing that support. So the question is, can we liaise with the bank? Can you go back to the bank and say, hold on, can I have interest-only payments for 6 months whilst I recover? Okay, which is something that the bank agreed to do. So you've got to kind of think about lots of things at the same time. Now, she wants to get pregnant next year. So my role isn't to say, yes, you can or yes, you can't. I'm not an advisor in that sense. My role is to help her make an informed decision after me explaining the risks and the benefits of doing each one, and what are the risks of her being on X medication, or do we stop it, all of those things. Okay? So what's going to happen? There's no fixed answer, and that's what the MEQ will be about. They're not expecting you to say, I'm going to stop this medication, because if you do, actually, that's a risky step to take. The examiners want to know, do you weigh up things before you take a decision? So the MEQ is all about weighing up. They want to see your entire weighing up possibility. You don't have to arrive at a decision, because ultimately the decision will be what the patient also says. Okay? So one really, really helpful model is the CANMeds model. So when you come across ethical dilemmas, have a think about it in the following domains. So the first domain is a professional domain, and that tells you, that basically is about the ethical aspects here. So acting in the best interest of the patient, confidentiality, duty to warn, not taking steps that might harm the patient. Those are some of the ethical dilemmas. Conflict of interest, dual agency dilemma, like I mentioned, expert witness versus treating doctor. So that's what you're thinking. Next is the educator role. An educator role is about psychoeducation to the patient. So in that question, you can see, if we just take that example, as I mentioned, of the bipolar affective disorder, wanting to get pregnant, wanting to go back to work, this is how you can think and write your answer as well. Remember, this is what is used to mark your MEQs, this sort of structure. They won't necessarily give the CANMeds, but this sort of structure really, really helps. Your OSCEs, your consultancy vivas, or leadership management vivas, that's the format. The CANMeds model is a very, very powerful model and is used for marking. So the role of an educator is the psychoeducator role. Are you able to inform the patient about risks and benefits to help them and the family make an informed decision? Collaborator, group dynamics. Do you have an awareness of conflicts, how to manage conflicts? What might happen in a ward when you have someone with borderline personality disorder and when staff are essentially disagreeing with you? Why might that be happening, etc.? Why might there be conflict within a team? That's collaborator role. When you're in consultation liaison psychiatrist, the neurologist has called you and said, take this person right now because this person's acting psychotic and this person needs to be on a mental health unit, but you have found that this person has fluctuating cognition. That's an MEQ. So you can see it's not just about, we don't know what the diagnosis is, but fluctuating cognition highly indicates that this may be actually delirium. So part of it is going to be the clinical aspect, but part of it is going to be how do you collaborate with the neurology team as well. Next is the manager. Manager is understanding of the clinical governance aspect. So how would you set up a service for a child and adolescent service? How would you set up an Indigenous mental health service? How would you set up a suicide prevention plan? Things like that. Okay, so that's the manager role, where it's understanding of the resources that you have and how do you implement them. That's to do with the clinical governance. So for example, there's been a sexual assault in the ward. How do you approach that scenario? That's about manager. Okay? Advocate, it's about patient advocacy. So this is about how do you liaise with the community? How do you improve the status of mental health in the community? And you can see all of those things will really help you for the essays as well. Next, the clinician is what most people are very, very comfortable with, because the clinician thing they do day in, day out. But remember, there are so many other domains that need to be brought out in your clinical practice as well. So when you're seeing patients in the ward, I know, when you're working in the inpatient, you've got a short length of stay so people get discharged quickly, but at least think about what are the kind of things that I need to think about for this person if I were a private psychiatrist for this person in the community? Just think, and it might take you 2 minutes, but it will help because it will all add up because you're asking yourself a question. Okay, there's a valuable piece of advice that I took on, and this is by Charlie Munger, who's Warren Buffett's partner. He says, my aim has always been to wake up a little bit wiser than when I went to bed the day before. And I think that's really what you're trying to achieve, just a little bit every day, just asking a question that adds on to your existing knowledge. And it's sort of this gradual progression where you don't realize you've learned, but you've actually matured as a clinician. And finally, scholar. And scholar is to do with your critical appraisal, research statistics. Are you able to look at a paper and appraise it quick enough to provide, or to make a decision, or to let the patient know what your steps are going to be?